All right, we will now start the webinar. Welcome everybody to today's HLAA webinar. We're all ears, person-centered hearing care. I think it just started. I'm gonna restart. Sorry about that. Welcome everybody to today's HLAA webinar. We're all ears, person-centered hearing care. Thank you for joining us today. My name is Amanda Watson and I am the meeting planner for HLAA and your host today. Today's presentation is being recorded and will be available for playback at a later time on the HLAA website, hearingloss.org. Now I'll give you some technical tips to get started. To see the captions on this webinar, you will need to click on the CC icon and click on Show Subtitle. You can change the font size in subtitle settings. Chat is available for technical issues and panelists only. We would like you to participate, so please ask a question in the Q&A box. You can find the icon at the bottom and we will use it to facilitate questions and answers to Bert after the presentation. If you joined by computer, the presentation should be in side-by-side mode. Slides are on the left and panelists are on the right in gallery view. You can change the font, the size of your side-to-side view by hovering between the two screens and moving the gray bar to adjust to your desired size. If you've joined by mobile device or phone, your view may be different and you may have to scroll between views to the desired one. Our presenter today is Bert Myers. Bert is a digital innovation and learning manager at the IDA Institute, and he is responsible for developing, planning, and driving their integrated online resources, including the IDA Learning Hall and their e-learning platform. I'm going to stop my screen share now and pass it over to Bert. Go ahead.
Perfect. Thanks so much. Let me start sharing my screen then. Just a sec. Here we go. All right. Well, thank you for having me. Thank you for joining us today. 2 o'clock, wherever you are in the US, it's 8 p.m. here in Denmark. Before we get started, I just wanted to start with sort of take a temperature in the room, get a sense of where people are in terms of today's topic. And as this is an online meeting and not a in-person meeting, I cannot really do a show of hands. So I would like to do a quick poll using the poll function that we have here with 3 basic questions. So how satisfied are you with the hearing care that you have received so far in your life? Are you extremely dissatisfied, somewhat, I'm neutral, I'm satisfied, or I'm over the moon happy with the care that I've received? Then the second question, how has the care that you have received, in your experience, how has it been tailored to really meet your needs specifically? Not at all, a bit, or very much? And are you familiar at all with the term person-centered care? So these are 3 questions. Great, they're up now. So you can go ahead and start answering the poll, and then we can get a bit of a sense of where people are in terms of how you have experienced the care that you have received, and whether you're completely new to the term person-centered care, or whether you've heard about it before, or whether you're an expert and you're going to take over from me after the next slide. So I'm gonna, I think half of the people have voted now. So I'm gonna give you another minute or so. All right. So you are able to view the poll results. This is not classified information. It's quite positive actually how people have received are satisfied with the care that they have received. The majority here is sort of in the top part of being satisfied. Some even over the moon satisfied. Person-centered care is a nice division that it's completely on the scale. The big majority in the middle, but also quite a few people have no idea of what I'm going to be talking about, which is always nice. And some people are quite familiar with it. So hopefully we're going to get some good questions out of you at the end. And in terms of the second question, to what extent has the care been tailored to your needs? There's only a small percentage that hasn't really experienced that. So that is very encouraging actually to hear. Good. So person-centered care. I'm just going to stop this poll here and move on to the next slide. So today's session, we're going to focus on person-centered care. And what do we mean with this? So at the IDA Institute, we say that helping people hear is about knowing how to listen. And a good hearing care professional will actually work with you to understand your individual needs and make recommendations based on those. That, in our view, is person-centered care. And today we'd like to cover what you could do as a receiver of care to help your provider so that they can help you better manage your own hearing loss. I don't have a hearing loss, so rather than hearing from me, I think it's more interesting for you to hear from someone who has actually been living with hearing loss. So I'd like to hand over to one of our collaborators, Sherry Eberts, here in a video snippet. Some of you might actually know Sherry as she's been a member of the board of HLA for quite a few years, and she's an active blogger on hearing loss. So maybe this will be a familiar face for you. So let me just pull up the video.
So I'm Sherry Eberts. I'm a hearing health advocate and a hearing aid wearer, and I am the founder of livingwithhearingloss.com, which is an online community for people who are living with hearing loss and also tinnitus. I found that writing about it and sharing my story was the best way to help myself, but also connect with other people with hearing loss, and that makes such a difference for me and also for them. We can share our experiences, share our tips, our best practices, and it's a lot of fun and very important. I think it's important to be very upfront about the hearing loss rather than trying to keep it a secret. I think that most people can tell anyway. Well, I think person-centered care is really everything in terms of trying to treat the hearing loss patient. I really would like the audiologist to understand the patient perspective a little bit more. I think it's hard to be an audiologist today. It's a difficult practice. It's very technical, and the way they're trained is much more about the science and the technology and not so much about the emotional experience of hearing loss. So really what I would like to see is audiologists become more partners with the patient and really try and understand the individual needs that each person has and figure out a roadmap and a set of tools that that person can use for themselves.
So I just had a look at the Q&A session, or the chat function actually. So thank you for the input. I was told that I'm speaking too fast, so I'll try to slow down. Let me know if I'm talking too fast and I'll try to adjust. And another good question actually that is speaking to my next slide is just a quick introduction to the IDA Institute. So the IDA Institute, the mission of our institute is to build a community that embraces person-centered care and empowers people to get the hearing care that they need. You can see the IDA Institute here in the picture, and just some quick facts about our organization. We are a non-profit organization based here in Denmark. have been established in 2007, so 13 and a half years ago, and we are funded with a grant from the William Demand Foundation. William Demand Foundation is also the owner of a couple of hearing aid brands, and I must say that we are completely independent, so you will never hear us recommending any kind of hearing aid or just the fact that you need to get amplification. That's none of us. We are not touching anything technical. We're focusing on the counseling of hearing loss and the human dynamics, if you will. We have an online community of about 18,000 members coming from all parts of the world, and we have now about 27 partners with partner organizations that include universities that teach audiology, professional organizations, and patient and consumer organizations such as HLA from different parts of the world. So a little bit more about person-centered care and what we mean with it. Person-centered care has many definitions. And in 2001, the Institute of Medicine coined the definition that has been used widely ever since across different healthcare sectors to describe the essence of person-centered care. And here it's described as care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that patient values guide all clinical decisions. For the past 13 years at the IDA Institute, we have been defining PCC according to these 6 elements. And we have encouraged and invited hearing care professionals to practice according to these 6 principles. So this is getting an understanding of individual preferences and needs. As you and I are very different, our lifestyles are very different. So if you and I both have a hearing loss, then also our hearing needs are very different. Empathy, a demonstration of empathy, shared goal setting and decision making, which is very use lists with checkboxes to just go through procedures. Active listening, so rather than sitting on your computer and taking notes, making sure that you have visual contact with the people that you're talking to. Open-ended questions and reflective conversation. So rather than asking someone, do you have trouble hearing the TV at home? You can ask, where is it that you're having trouble hearing people? And also the involvement of family and friends, as they can be great supporters for someone on their journey with hearing loss. And for the first 10 years or so, we have been advocating for these 6 elements for hearing care professionals to practice according to these principles, but we felt that this was too one-sided. So what does it actually then mean for someone living with hearing loss, these principles, and how can you elicit person-centered care, or how can you demand person-centered care? Obviously, you cannot just demand a hearing care professional to be more empathic, or when you phone in to call in for your next appointment, you cannot ask for the clinician with the good listening skills when you're booking your appointment. And Shari, in the video that we just saw, she shared the idea of hearing care being a partnership between a hearing care professional and their client. But what is then expected of you in this partnership, and what can you contribute with? What can you do to elicit person-centered care? For this, we created a little campaign video that I would like to show you next. So what we have done here, we've tried to look at these 6 elements and try to translate them of things that we can ask hearing care professionals to practice, and looked into what does this mean for individuals. And so these are these 6 things that we think that we as consumers can do to help the hearing care professionals. So let's briefly go through these and what they possibly could mean. So the first one is to take part, and it takes 2 to tango, right? So it's important to become actively involved in your own hearing care. And the more you reveal about your personal challenges, the more information your audiologist will have when planning possible solutions. Here are 7 tips, again from Shari, actually, that we have seen in the video, that you can find on our website with a little bit more elaboration. So, as I said, you need to share your hearing loss and struggles. It's not the time to play the tough guy. Secondly, to come armed with facts. Note down where it is, when it is, what you were doing when you were having trouble with your hearing aids, or where you're trouble hearing. The more data you can provide, the more that will allow your audiologist to make a more informed decision. Leave your anger at home. Hearing loss is very frustrating, and while hearing aids supposedly help a lot, they're not perfect solutions. I think we can all agree on that. So it's important to maintain sort of an analytical attitude towards your communication issues, and anger won't solve problems, but it might actually help you, it might actually prevent you from finding creative solutions. The fourth is, obviously you need to properly maintain your hearing devices if you have them, which can be very cumbersome, especially if there are small parts involved that need to be removed and cleaned. But keeping them in good condition will also really contribute to your relationship with your audiologist, and show your audiologist that you're actually serious about your hearing. Number 5 is to respect your audiologist's training and expertise. You are the expert of your own experience and your own communication needs and desires, but the audiologists possess the time-tested diagnostic tools, programming methods, and blending these 2 together is where you can get the best results. You need to honor your journey, so your relationship with your hearing loss and your audiologist may change over time as you accept your hearing difficulties and learn more about the different types of assistance that you might need. And teach what you know. And I think this very much goes for HLA, right? So when you discover new tricks or useful apps that have made certain situations easier for you, spread the word to other patients, as you can benefit from other tips and tricks as well from other people. To be seen is the second one. It's important that you let your audiologist see things from your perspective. And in order for you to provide, for your provider to be able to show empathy, you need to be able to make yourself vulnerable and probably overcome certain areas of embarrassment. To be heard. So next, I would like to again show a video of Faye, who really found hope when her audiologist actually just took the time to listen to her.
It's changed our lives quite dramatically, especially with my children. Sort of, I mean, they have to turn and look at me to speak. I can't hear them, especially for outside. I'm walking to school and they get quite frustrated with that. And they know, and they'll say, "Mummy, I'm really sorry." You know, if they've got their back to me and they say something and they're facing forward, I just can't hear it if we're outside. I'm like, "No, you've got to turn and look at me." I find I don't like to talk about it with my family because I don't want them to worry. No, I don't want them to know how bad it is. So I pretend everything's great when actually inside I'm thinking, because I don't want them to worry and I don't want them to be upset. I don't want them to, you know, they've already lived it with me. They see it, you know, they see me sat there looking exhausted. It was Bridget that really sort of said, like she just didn't I think she didn't give up, and that for me was for everything, because I felt someone was still trying to help me. And I knew that there was something wrong, and she just listened, and she just said, okay, let's work it out. And as soon as she found it, I think we were both just like, yay, because we'd worked out she'd worked out what it was. She gave me hope in a way that, don't worry, we could still try and improve this to get it to the best we can. And I think that is what I appreciate more than anything.
Next one is to take your time to tell your story. It's important to tell your story. And next, again, I think it's more sincere, more genuine is if these things come from somebody with lived experience. So I'd like to listen to Nick as he shares how his audiologist helped him rethink his hearing aids, how to find a solution that fits his lifestyle, as his audiologist quickly came to realize that he loves technology. So what can we do together to help you?
Hi, my name's Nick Head. I'm from the UK. The first time I can remember in my hearing loss journey actually really being heard by a hearing care professional was when I met my current audiologist over 20 years ago. And up until that point, I'd been wearing in the canal hearing aids at my request. I'd never been told before that actually I was under-aided, that I needed to have larger hearing aids that fitted behind my ears and were more visible to meet my needs. As this audiologist got to know me, he also realised how into technology I was. So, for example, if ever I was going to invest in a car or a new computer, laptop, or some sound hi-fi equipment, I'd really do a lot of research. And being as I was going to be spending a similar amount on my hearing technology, he really got that I was quite switched on technology-wise. So these days I have everything from remote controls, Bluetooth technology. I've got audio jacks that let me stream from the TV, from the laptop, and I can't live without them now. I listen to music direct from my phone and make telephone calls with them. So if it wasn't for him, I now realise I was receiving person-centred care. But if it wasn't for him, he was the first person on my journey that had actually intervened and told me in the canal aids aren't really for you. So I'm really pleased we met. And as I say, I'm still with him today. So I still feel heard.
The next one is to be clear. For an audiologist to provide you with care that is actually directed to your needs and preferences, it's of course, it's crucial that you are able to express these needs in very clear, unambiguous terms. The last one is to open up. And next we're gonna hear Nikki's story about how she went from trying to hide her hearing loss to being very open about it.
Nikki has a real strength of character, and she has, I believe, a very supportive husband.
Your friends are key to accepting the way you are, as well as helping you.
Yeah, but yeah, like I said, educating them as well. Telling my friends, you're gonna look at me. I don't understand what you're saying. What do you mean by that? What does that word mean?
And they're very receptive to what Nikki's telling them. And anybody she speaks to in our group of friends, they will be aware and look at her. And if she's not, or they forget, that they soon realise, oh right, yeah. And they're very, very good.
Yeah.
And to the stage where, like myself and a lot of people, they almost forget that she's deaf.
Mm.
When I was about 19 or 20, it took me a long time to get the confidence to say, I'm hard of hearing, just to let you know. It took me a long time to really, because when I got into the makeup industry where I wanted to be a makeup artist, obviously it's very fast-paced environment and very people don't really have patience for me or anything like that. And I understood that. I kind of accepted it, even though it was hard because I felt that I had to keep up with you guys. And then it got to a stage where I thought, you know what, I am partially deaf, so if you have any, you know, just to let you know, because I don't want you to think that I'm being rude, because, you know, some people have thought I was rude because they'll say something to me and I'll walk off, or, you know, all those kind of things. So, yeah, it has been quite hard, I have to say, but it's also, I don't know, it's kind of, I think I became a lot more confident and not so embarrassed about being hard of hearing. It's not a bad thing. I think the more you talk about it, the easier it becomes. And I think that I'm very open about it with my friends, and I'm very open. Whereas before, when I started dating, I wouldn't say a thing. I would say anything. Because I felt embarrassed. I thought, oh, I'm not going to get a boyfriend because they wouldn't go out with the deaf girl, and why would they? Then I thought, hang on a minute, you know, I'm okay. It's just that I just can't hear. Basically, what I'm actually saying is I'm just asking for just a little bit of consideration. That's all. That will make my life easier and your life so much easier. This is me. Take me or leave it.
So these are the 6 things that you can do to elicit person-centered care. To make sure to be seen, to be heard, to take your time and tell your story, to open up, to take part, and to be very, very clear. And for some of these things will come naturally, and for some of us, some of these things will become more of a challenge. But this is, at least in our view, something that can be helpful in someone's journey and their relationship with their audiologist. On the IDA Institute's website, you'll be able to also find a lot of research on person-centered care. And looking at this research, we can actually see some clear benefits to person-centered practices. For people with hearing loss, these are greater satisfaction of care, better results of treatment, and people have reported that it's easier to follow recommendations of the hearing care provider. But also hearing care professionals will experience benefits when practicing person-centered care, such as a need for fewer diagnostic tests, time saved in appointments, increased patient satisfaction, better clinical outcomes, and increased employee satisfaction, because people think that they feel that they are doing a better job and having better impact. And I guess that is why people start working as an audiologist, is because they want to help people, I assume, right? So if you feel that you're being more effective, you'll get more joy out of your work. So looking at these two together, it's really in the best interests for all of us to both provide and receive person-centered care. So one missing piece of the puzzle here is to then also hear it from an audiologist, and how they see person-centered care. So next we'll see Bridget, who was mentioned in the video as the audiologist of Faye.
Person-centered is a time saver because it results in perhaps a higher accuracy in service provision, more pinpointed solutions, and therefore hopefully a happier patient or happier client quicker. If one wasn't patient-centered, person-centered, that one would perhaps not really give exactly what would suit. Hearing is emotional. It is so key to who we are and our enjoyment of each moment and our ability for us to reach our potential in life. I can imagine a future where clients or patients do demand that their care is tailor-made to their needs and that it's based along the lines of person-centered care. So I actually would hope for a future like that, actually. It makes the experience for the clinician, I think, more detailed. It allows the patient to receive a more refined care package, and I think all around it would be good actually that there's an expectation and reciprocity to that expectation. I'm a big fan of person-centered care. I aim to continue working this way. And certainly for me in my job satisfaction, it's a core part of why I get up in the morning and why I aim to, design or craft the most bespoke, tailored solution for each person, and to try and draw from the buffet table, should we say, of what's available, and to pick from that with that client. We walk along the buffet table and pick from that what is going to work for them, and then we sit together and we create the recipe, we talk about it, and then we put it to the test, and we come back and we discuss how it's gone. And I think for clients or patients who need that, that's what my offer is, I guess. And so that's my story.
So what is it that we at the IDA Institute then do in order to get audiologists to become more like Bridget and understand the value of practicing according to person-centered principles and instill this in their everyday job? And there's a lot that we do. We have been focusing initially for the first 10 years or so of the Institute on specifically hearing care professionals. And most of our resources, if you go to our website, you will find that most of our resources are geared towards that audience. And it's only recently in the last couple of years that we opened up our scope and tried to really speak to people with hearing loss as well, as we felt that at this point we have a lot of resources and knowledge that we can actually share with people that live with hearing loss, such as the videos that we have just seen. We have a whole vault of videos on our website available for people that hopefully can provide some inspiration. So another thing that we do is provide training to audiologists and partner with professional organizations to make sure that these trainings are then accredited and promoted. And again, we are a nonprofit, so everything is free of charge. But then we have created a benchmark, if you will, for person-centered care, which is called Inspired by IDA. And this is a certification, if you will, that people can get the moment they have taken two specific courses on our e-learning site, and they sign this code of ethics. And by signing this code of ethics, the signatory expresses his or her commitment to providing person-centered care and to helping their clients make informed decisions that will allow them to better manage their own hearing health. Again, we are a small team, so there's not a whole lot that we can do to enforce. We cannot go and audit clinics ourselves, but at least we hope to provide an incentive for audiologists that helps them also upskill and provide better care, and it's something that helps them also stand out from their competition, as many of them are privately owned businesses. And then we have a couple of collaborations with some clinic locators as well, and we're trying to add them more gradually, where you as a consumer could then, when you're looking for an audiologist, you can actually search as a criteria for people that are accredited as Inspired by IDA. So this is a screenshot from the Find Hearing website, where you could see that there's at least 2 there in the Bay Area. We have a couple of more resources, and again, everything is free of charge. So I'm not selling you anything here during this webinar. And our resources are not developed just by us sitting in our office in Denmark, but we actually co-create these with people from around the world that come from a perspective from academia, from private clinics in the public healthcare system, people from the VA, and people with lived experience of hearing loss. And so what you can see here on the picture is a brainstorming session where people are creating solutions at one of our workshops. And so I want to share a couple of the resources that we have available for you on our website. And one of them is, I think, already addressing a point that was raised in the Q&A about how are we supposed to read lips when people are wearing face masks during this pandemic. And so what we have created together with our partner organizations is a short list of 10 tips to make communicating with people with wearing face masks a little bit easier. And so this is a PDF that might actually be available on the HLA website. You can see at the bottom the signatories of this little paper that you can download, and you can distribute it to make people aware of the fact that face masks are actually hindering people that suffer from hearing loss. Another resource that we have are our telecare tools, these online telecare tools that can help you articulate your needs, specifically when preparing for an appointment. And from our partnership with HLA, we've been able to embed these on the website. So the moment you click on Hearing Help in the top left corner, there is a section there that allows you to go to the IDA telecare tools. And just a quick run through of what one of them looks like, for example, is Living Well Online. It's very visual, so you can choose an image to prepare your appointment of saying, okay, this is a situation where I'm having trouble communicating. You can either take one of the existing images that show watching television or being on the phone, or you can upload an image yourself. And then next you can put some more words to it. So saying, I have frequent meetings at work and struggle to hear when we are together as a group, as people talk over each other, and I tend to miss part of what is being said, and throwaway comments get lost in laughter, and I sometimes feel a bit lost. And so you can then rate this situation as a traffic light, as this is very difficult. Following up from that is then, okay, what is a specific strategy that you are already using or could be using that might help you? And so there's a selection of strategies available that you can tick. You can unfold with the little arrow on the right. So there's a little bit more explanation of what this entails, and you can describe your strategy as well. And then at the very end, you can then send this off directly to your audiologist. So the moment you come to your appointment, you don't have to think on your feet and come with situations and examples of where you're struggling, but in sort of the convenience of your own home, you can just think quietly, okay, when was it last when I really was having issues? Or when was it last when I actually was thriving and didn't have any issues as well, as that information can also be helpful. So this is just a quick example of one of the tools that is also available both on our IDA Institute website, but also on the website of HLAA. And then I wanted to share with you, this is a tool in the making. So this is, you're getting a preview here. We are developing a resource that are phone tips. So what can you do speaking on the phone? And so we have collected 10 tips of what you think could be helpful. So first is minimizing any background noise around you. Suggest that someone on the other end does the same. As a hearing care professional, you need to make sure you are talking directly into the phone and you're using speakerphone. Avoid using the speakerphone. The third is you need to avoid shaming. So you don't ask, do you understand? But you ask, did I explain that well enough? You need to use tonal variation to emphasize certain words and phrases. And you need to speak clearly and at a normal speed. Talking too fast or too slow, both can be hard to follow. Let's look at the next 5, and then you have the opportunity also in either the chat or the Q&A to come with comments and feedback, as this is not published yet. This is a work in progress. So your feedback here will be tremendous if you're thinking of something that is not on this list. So continuing on number 6 is when saying letters, give an example, such as C as in Charlie or D as in dog. 7, be brief. Unnecessary words create a cognitive load, which is an obstacle to understanding. Number 8 is indicate topic changes to prepare people for what they are about to hear. 9 is pause within sentences, between sentences, and between speakers if there are more than one. And 10 is make notes of what was discussed and send a copy to the person you are speaking with. So these are our initial draft 10 bullets that we want to distribute for audiologists and specifically give them to their front desk staff to make sure that these people who specifically front desk staff might not have had exposure or training of working with people with hearing loss before. So giving them some easy hands-on tools that might improve their everyday procedures. So if you have any additions or feedback to these 10 tips, then please share them. This was all that I had for the moment. So I think we're going to open up for a Q&A. We're going to look at the Q&A box and I'm going to answer some questions that were answered there. But after this session, you're also welcome to go to our website. If you enter the website, you can immediately identify as whether you're a hearing care professional or you're having trouble hearing, so that you land on the appropriate pages. And you can also read more about the We're All Ears campaign that I showed you the video from on the second link here. So I will now switch over to the Q&A. There's a question. Which is better, family-centered or person-centered care in terms of hearing improvement? So family-centered care and person-centered care are close to be the same concept, whereas family-centered care is very much taking also a look at the earlier stage of hearing loss and looking at pediatrics, so involving the family at an earlier stage in the hearing loss journey, and making sure that also the care that is being received by a child, that is also centered around that person and is inclusive of the person with hearing loss there. So both are they're not mutually exclusive, and we're currently at the moment developing a course on family-centered care and looking at the pediatric journey and resources that we can provide audiologists for working with children. So I hope that answered the question. The next question here from Michael Quinlan is, what should the future audiologists need to be skilled at? Fitting hearing aids, programming CIs, knowing assistive devices? Should they be specialized? Should some audiologists be able to counsel on coping skills and assertiveness training related to hearing loss? This is an excellent question. I think there's 10, maybe 20 questions within this question. And I think without a doubt, in the future, audiologists will need to focus on counseling more and more, as for many reasons. First of all, you have the OTC bill in the US that got passed, right? And so if what I used to provide as an audiologist, the provision of hearing aids, people can go next door or go buy them online, go to a Costco, go to a Walmart, and you buy your hearing aids. What is then left of the service that I can provide? And I think counseling is something that can really help audiologists in setting themselves apart and offering something that can be truly meaningful for people with hearing loss. At the same time, the business models need to be looked at, as what I have heard, at least from members of HLA, is that perhaps there's too big of a focus on selling hearing aids and not any of the ecosystem that falls beyond that. So there's not any knowledge about assistive listening devices and how these can also be helpful. So that's definitely something that audiologists need to be trained at. We're currently in the process of an innovation process at the IDA Institute where we are looking specifically at the future of hearing care. And we're looking at 10 years from now, what does hearing care look like? Excuse me, with big tech. What is the role of these big tech companies that we have? What is Amazon going to do? What is Facebook going to do? What is your iPhone going to do? And so what does that mean for the role as an audiologist, but also for me as a person, as a consumer? We will be launching a report on our initial investigation this World Hearing Day, I think in March. So you can be on the lookout for that. And then based on that input, we'll be developing a couple of new resources as well. So excellent question. And I think we can take another hour to answer that question specifically. So there's another question about if I have any advice on how to overcome shame about being open about your hearing loss. I don't. And that is simply because I don't have hearing loss. So I don't think you should take my word for it. What I can only recommend is reaching out to HLA chapters. And if you're part of a chapter, reach out to members of that chapter and to have a look on the different websites available. So I think the blog from Shari is excellent, has a lot of excellent resources. HLA's website, obviously, and then also our own website. As I said, that we have a lot of video testimonials on our website where people with hearing loss share what has helped for them and what has made a difference in their journey. Michelle, you're very provocative with your question in terms of that I'm preaching to the choir here, and I'm not sure if I am, but your question, not so much a question, a comment in terms of we know all of this already, and of course we want to be heard by hearing care professionals. So I feel that this presentation should be directed more towards audiologists and ENTs. Or that I should be sharing more suggestions of how those with hearing loss can actively be heard and receive person-centered care. And of course, I'm not in disagreement with you at all. And I just want to clarify by saying that our day job up till very recently has been exactly that, reaching out to audiologists, going to all the seminars and conferences and preaching person-centered care and saying that this is the importance of it, the research that underpins it, and also showing how it can easily be done. So that is what we've been primarily focusing on. And recently, with our partnership with HLA, we have started reaching out more also now to people with hearing loss, for you also to be able to tell us how you think you can be actively heard and receive person-centered care. So I still very much welcome any kind of input that you have through the Q&A or the chat in terms of ideas. If you feel that the messaging that you saw in this presentation wasn't appropriate, then please let us know, because we're eager to improve. Let me look at other questions, as a lot of them came in. And I'm not sure if all questions are questions that are really up to my expertise, or actually questions that are more up to the expertise of people in your local chapter, in terms of where you can find a good ENT or a good audiologist in your area. I can see that there's already a comment for the phone tips that staff should always develop rapport and train and explain to them how it looks as they work with clients and patients. I think that's an excellent one. Michael is asking about whether the UK provides hearing aids free of charge and the US does not. So I don't live in the UK. I've spent a bit of time there, and I think in the NHS, the National Health System, you can get hearing aids free of charge. There are shortcomings, however, as the contracts that they have with the manufacturers don't always include the most optimal and latest devices. There is a waiting time, and the care that people receive through the public system is not always experienced in a way that there's a lot of room for people to practice person-centered care, as the public healthcare system is very much under stress. So it depends on where you are in the UK, but I think a challenge is that people are seeing 100 patients a day and simply don't have a lot of time to really sit with their patients. Robert asked a question whether there are aspects that are additional for people with cochlear implants. Not to my knowledge at this point. We do have some resources that are developed specifically for CI, and we have developed a tool that is developed for specifically the early stage of the CI, as it's such a big journey to go on to get an implant. That we have created a tool that allows you, again, like the telecare tool that we showed, to be overwhelmed in a appointment where you're getting the news that you might qualify, to then be able to sit at home and go through your thoughts and write them down in a structured way. So and we've done this specifically for people that are ready for CI. That is the only resource, to my knowledge, that we have available on our website, at least. I have another great question that I don't have an answer to, but I want to address. There's an attendee that says that they are in denial about their hearing loss, and it frustrates everyone around them since he or she refuses to wear hearing aids. And so how can I better cope with this? And what we have seen in terms of people being open for accepting hearing loss and accepting the need for amplification and getting hearing loss, this is a cycle of behavior change. And so this is about breaking habits, and it's a similar cycle that research has shown that people go through in maybe a 7-year process of being more open to the idea and being able to just accept for yourself that you even have a hearing loss is already a big accomplishment. But this is a similar process that people go through when you're trying to change other habits in your life, such as losing weight, quitting smoking, drinking less. All of these things are things that might be good, easy for you to do day 1, but day 2 or day 3, it's more difficult. And so I think the only thing, again, I don't have an answer, but I think don't be too hard on yourself. But the fact that people care about you and are frustrated with this, I think that is already a blessing. So I'm sure that people at the HLA chapters are able to provide you with excellent support. There's a lot of questions in here, and I'm not sure all of them are for me. So one more that I'm going to pick out here is that someone says that the audiologist says that you can hear very well with a hearing aid, but I do not find that this is true. It is not a prescription like you get with glasses for perfect vision. Is this right or wrong? And the comparison has often been made between getting glasses or a hearing aid, and it's very misleading because it's an instant effect when you get glasses on. If you need glasses and you put glasses on, your vision is corrected. The moment you take them off, your vision goes back to what it was before. Glasses are very accepted. There's less of stigma around glasses. It's people that you see a lot more young people with glasses rather than the majority of people with hearing aids are supposed to only be elderly people. So it's not a fair comparison to make, whether it's as easy as putting on glasses. A lot of people need to get used to their hearing aids, I've been told, and you need to train your brain, you need to train your ears, and you need to find the right settings, and this takes time. So I don't think it's a plug and play solution, and it's definitely not a silver bullet. Hearing aids have come a long way in the last 30 years, but they're by no means a perfect solution that fix your hearing 100%. And I think it's important for your audiologist to also give you realistic expectations that the moment you're going to get hearing aids, there's other ways of support that you might also need in terms of finding really good communication strategies and still understanding of what it means to live with hearing loss and strategies that you can do in terms of placing yourself in a room strategically. So I hope that answers your question a bit. Maybe we have time for one more. All the other questions that I haven't gotten to, because it's starting to fill up here, we'll make sure to write them out, and any questions that I can answer, then we'll do that in writing and make them available together with this webinar and the slides on the HLA website.
You can answer one more quick question if you want, Bert.
One more. Let me just quickly find one. They're so good.
While you do, I'm going to change this.
Okay, one last one about tinnitus. So it seems that some audiologists don't want to address tinnitus and only want to sell a hearing aid. I think there's a lot of audiologists that are not experienced in treating tinnitus. Tinnitus is very contentious. I think there are many different people with very different claims to fame in terms of what a good treatment for tinnitus is. I think people are still struggling to understand what causes tinnitus. We have a couple of tinnitus resources on our website, and this is again to illustrate that the IDEA Institute doesn't do anything technical. We don't have any our tools for you as a tinnitus thermometer, for example, where you can visually, on a scale of 1 to 10, you can mark how difficult has your tinnitus been for you since the last time you saw your audiologist. And with that, very often, the moment people start tracking their tinnitus experience, they can see that even though the tinnitus doesn't go away, how much they've been bothered by their tinnitus declines. And so we can very much see that people are able to live with tinnitus, even though it can be very incapacitating. People can live with tinnitus. And so through that, we want to share a sort of a message of hope. But I do think that there's a lot of audiologists that are simply really afraid of dealing with tinnitus, as it's what I have heard from people that have suffered from tinnitus. Yeah, it can be very dark. So yeah, we have about 48 open questions that we haven't answered yet. So we'll definitely need to do a write-up of that. But thank you all. These are excellent questions.
Thank you, Bert. Yeah, as Bert said, for any of the questions that weren't answered today that he can answer, he's offered to answer these questions, and then we'll post them on the website along with the recording to this webinar. Again, thank you so much, Bert, on your amazing presentation. Thank you to Terry O'Connor for her CART services. This webinar will be posted to the HLA website at hearingloss.org. And you can check hearingloss.org for our future webinars and webinar recordings. Thank you so much for joining us today. Stay safe and be well, and we'll hope to see you on the next webinar.